Good evening. Changes made at the VA after the 8 News Now investigators exposed flaws. Vanessa Murphy first obtained videos showing a delay in care for a veteran moments before he died. Thanks for joining us here at 11 o'clock. I'm Denise Valdez.
And I'm Brian Loftus. Now we have the results of what federal investigators found as a result of her story. Now
we do want to warn you that the video in this report is of a sensitive nature.
A federal report confirming what the 8 News Now investigators first exposed more than a year ago after this video was leaked to us. This 88-year-old Marine Corps veteran didn't get the medical care he deserved after he collapsed inside this VA medical clinic on the east side of Las Vegas. Moments later, he died. We interviewed the head of the VA healthcare system in Southern Nevada before our story aired last May.
Do you think care was delayed? Hands-on care to this patient?
So without getting into the details of that patient, I would have to say no.
What William Caron didn't know then, we had this video.
I'd say we responded accordingly that you would see in any other healthcare clinic of that nature.
But according to the Office of the Inspector General, this didn't get a thorough review by facility leaders like it should have. It has now after our story aired, and Nevada Senators Jackie Rosen and Catherine Cortez Masto demanded an investigation. We exposed the timeline of events. The veteran collapses and hits his head. 2 minutes later, a nurse arrives, and she does not administer CPR. 4.5 minutes later, a second nurse begins CPR. We had shown this video to a neurosurgeon and attorney with experience in medical malpractice.
How critical is this situation?
He is dying.
You're in a facility where you think that you're going to get medical attention and you think, people are going to run to your rescue, and that's just not happening here.
The Office of the Inspector General concludes this nurse delayed initiating CPR. Overhead speakers for an emergency response weren't working properly. Staff didn't document and review this properly. And the veteran had told staff he felt dizzy 4 days before this, but he didn't receive the care he should have. 5 recommendations are made. VA Southern Nevada responding that it's working to make the changes. The report notes, as we first reported, no autopsy was done, so it's unclear whether this delay in care contributed to the veteran's death. Still, also noted in the report, the veteran's family should have been told about the delay in care. They were unaware until we told them. Vanessa Murphy, 8 News Now.